Republicans say they are not giving up. Did you see the latest? A few hours ago, Senate Republicans forced a vote in the Senate to repeal the health care law. And guess what? Well, you guessed it. A party vote straight down party lines. 47 to 51, Democrats win. The repeal is dead for now, but Senate Majority Leader Harry Reid shouldn't be popping that champagne cork, at least not yet. Republicans are planning to come back swinging, not to mention the judge's ruling in Florida on Monday that declared the entire law unconstitutional. South Dakota Senator John Thune is here to tell us what's next. Senator, what is next on the Republicans in the Senate?
I think we're moving in the right direction. We got 40 votes in December, 11 months ago, against this health care bill, and today we got 47. So we're moving in the right direction, and I think there will be additional efforts. Obviously, this was a big vote. It was a vote that we needed to have. It put everybody on the record. And I think the other thing that didn't get reported as much today is there was another vote to strike a particular provision in the bill that passed by a vote of 81 to 17.
And that's the one that had more paperwork for businesses in the bill.
Right.
Okay, you know what makes me crazy about that?
Right.
Is that if anyone had, I don't mean you because you're a Republican, Republicans vote against it, but if anyone had read the bill beforehand,
right,
you wouldn't have had to do this and spend all this time doing that repeal today that now everyone is saying is so great. You know, maybe if the bill had been read ahead of time.
Well, even by the IRS's own estimate, it would have impacted 40 million small businesses in this country. It was a massive new paperwork requirement, red tape, bureaucracy, something that small businesses don't need to contend with. And it was one of those things, it was buried in the fine print in the bill, and then all of a sudden, when it passed, and Speaker Pelosi said, when it passes, we'll figure out what's in it, and that's exactly what is now happening, and we're seeing some of these things. And that was a provision that even the Democrats, who were reluctant initially to come on board, agreed with us that that needed to be taken out.
Well, let me pick another thing that the American people, I think, should be disturbed about. And again, I guess that the Republicans can't be blamed for this one. But it's the easiest example is Senator Claire McCaskill, who voted for the health care as a Democrat from Missouri. Then last August, there was a state referendum in Missouri. 71% of the people said they did not want that individual mandate. They were opposed to it. Now, it's the federal law trumps it, so it doesn't mean anything, but certainly is symbolic. Now, what she's quoted as saying is, and this was reported in The Hill today, there are other ways we can get people in the pool, I hope, other than the mandate, and we need to look at it. So now, more than a year later, almost a year later, the bill has been passed. The mandate is how it's funded. Now the Democratic senators are saying maybe we ought to look to see some other way to fund it. We've got the mandate problem. It's like if anyone had bothered to read it ahead of time or think about it, we wouldn't be spending all this time in all the courts, have all these problems, but nobody bothered, on the side of the people who are pushing it.
Well, and I think at the time the question that should have been asked, and ironically there was a hearing today in the Senate Judiciary Committee on whether the individual mandate is constitutional. That's a question that should have been asked a year ago. But now you've got two courts that have thrown it out. The most recent one, Judge Vinson in Florida, and he, because there's no severability clause in there, basically threw the whole thing out. And so you're going to have that going on in the courts. And I think that the Congress, you're also going to see efforts to strike, individual provisions, as I mentioned earlier. But the best way to deal with this now would be to throw the whole thing overboard. Because if you start doing this piecemeal thing and you start picking out individual provisions, the whole, at some point, house of cards comes down. And I think the best way would be to do away with it now, start over, do it the right way, focus on a quality health care reform bill that actually does put downward pressure on costs and lowers costs for most Americans, which is what they want.
The whole thing, though, I think really has shown the American people how the sausage is made, because I think most Americans want health care improved and fixed in different ways. But what has gone on in the last year, and now we're spending all this time and money, and it is still a mess, and nobody knows what's in it yet. And it is so extraordinary to me. It's like no one really did give a damn. It was just like, get anything passed so we can say we passed something.
They did. I mean, it was 1/6 of the economy is impacted by that particular decision. But I can tell you, and I think most of my colleagues would as well, that any small business that you talk to in your state, medium-sized business, big business, they all are really concerned about how this is going to apply and how they're going to implement this thing and how it's going to impact the cost of them doing business. But I think the public reaction to it was on two grounds. One is they didn't like what was in it. They found out what was in it, and they didn't like it. And secondly, they hated the process.
Well, I think that the process is what gets me.
I mean,
without any doubt in my mind, we need to fix health care. But the process, to me, and now because of the way the process was done, we're paying for it again.
Right.
And now it's Senator, nice to see you.
Always nice to be with you, Greta.
Gonna run?
Well, maybe to the Super Bowl.
Straight ahead. Thank you. Straight ahead.